Have you ever wondered and said this to yourself? You wondering if you are ovulating, what your fertile window is, and how come you just have not gotten pregnant yet, despite trying at what you perceive to be the right time. Ovulation, the most misunderstood part of fertility. It is the topic of this episode of Conceived, the podcast. Welcome to this episode of Conceived, the podcast with me, Dr. Kady. On this podcast, we empower women with medical truth about pregnancy and fertility. So let's start from the very basic. What is ovulation? Is the process whereby one mature egg is released from the ovum. Assuming that there are no other medical conditions that affect hormonal balances like PCOS, ovulation will happen once a month. So once every menstrual cycle. And a menstrual cycle for most women will tend to last between 28 days to 32 days. That's for women who get regular menstrual cycles. Did you know that once an egg is released, its lifespan is 12 to 24 hours only? Yes, ladies, the egg has a very short lifespan. A sperm cell, on the other hand, has a lifespan of 5 days. That means that if a sperm cell is already within your reproductive tract by the time ovulation happens and your egg is released into your fallopian tube, fertilization should, in theory, happen naturally without any delays, because the sperm cell is already present to fertilize the egg that will be released, that has resulted in pregnancy for them. Let me explain. The fertile window is actually 5 days before ovulation. This is because of the lifespan of the egg and the sperm cells that I previously described. So if you are a lady who has regular menstrual cycles, you need to realize that your fertile window will be 5 days before the egg is released and on the actual day that ovulation will happen. So going forward, after listening to this, you should no longer make the mistake that a lot of women are making, which is to only be sexually intimate on the day of ovulation. You should have your husband's sperm cells well into your reproductive tract, waiting for that egg way before it's released. So when I say way before, within 5 days. So if your fertile window is the day of ovulation, during that time, you need to be having sex every other day. Having sex every day can be quite burdensome for some couples. And remember, you are also supposed to enjoy the process of the way to getting pregnant. So it shouldn't be something that stresses you. Otherwise, this in and of itself can oppose and fight pregnancy. So you are supposed to be relaxed, and within those 5 days, and remember, including the actual day of ovulation, you ought to be having sex as regularly as possible. Not necessarily every day, but every other day should suffice. Thinking that ovulation day is the only day that you're going to be sexually intimate, that's actually quite risky, because life happens. What if your husband is not around? What if you both are not able to meet together for one reason or another? You will waste a cycle, the egg that is released during that cycle, if you have that approach or if you have that mindset about ovulation. Remember, if the semen is not already there, waiting for that precious egg that is about to be released, it may be too late. So many women are aware that they need to track their ovulation, but there are 3 main reasons why a lot of women do this in the wrong way. So let's talk about what those mistakes are, so that you listening to this podcast does not make the mistake at all, or you can stop making those mistakes if you are already engaged into making these mistakes. The first mistake is to think that every woman has a 28-day cycle. No, the 28-day cycle was given as an example and as a standard. But if your period cycle lasts between 28 days and 32 days, those are still considered to be normal cycle lengths. A cycle length is considered the first day of the bleed all the way to the day before the first day of the next cycle. So the first day of the next period. And how many of us can say that every single month they have had a 28-day cycle? Not many. Your cycle length can be impacted by various factors. For example, hormonal balances, being highly stressed, having intercurrent illnesses, and most definitely if you have conditions like PCOS or you have a malfunctioning thyroid. So if any of these are true for you, your cycle length is likely to either be shorter than 28 days or longer than 28 days. I'll just go back and make a slight correction. A normal cycle length is considered to actually be anything between 22 days all the way to 35 days. But to reiterate, for a lot of women, their cycle length will be anything between 28 days to 32 or 35 days. But if your cycle length is anywhere in between 22 days to 35 days, you are still considered to be having normal, regular cycles. Now, it's not going to be the exact length for absolutely every single cycle, just because our hormones tend to shift from month to month. But as long as it is within those range of days, your cycles are still considered to be regular. So imagine if your cycle is longer than 28 days, but you are banking on ovulation happening on day 14. So you are actively being sexually active around day 14 of your cycle, and the rest of your cycle, you're not being sexually intimate with your husband. You've actually missed it, because your husband's semen is going to be released into your reproductive tract and be lurking around there for about 5 days. Then eventually it's going to die off. But your cycle length is longer than 28 days. So you would have ovulated much later. And by that time, if you're not being sexually active at the right time, your egg that will be living for 12 to 24 hours will die because there is no sperm available, simply because you have miscalculated. One important medical truth that you need to take away from this podcast is that ovulation happens 14 days before the first day of the bleeding of the next cycle. So before the first day of your next period, 14 days before that is when ovulation will happen for you, depending on your individualized cycle length. The second common mistake is that we are now living in a generation where we use applications a lot. We have lots of apps on our phones that have been hugely helpful in helping us to do many things methodically. They have reminded us about the things that we needed to do. They have made access to key information at our fingertips and very easy. But if you are trying to get pregnant, ladies, I would argue that it's a huge mistake just to rely on fertility apps. Get this, ladies. Apps are estimative. They help you work out roundabout when it is that you are ovulating. They teach you the principle and the concept, but they are not precise. You cannot solely rely on apps when you are actively trying to fall pregnant and take the information that the application gives you as the gospel truth about when your body is ovulating. Though apps are helpful, they don't actually know what your hormones are doing real time. The third mistake is how women have been using the ovulation testing kits detect the surge in LH. Remember, this surge in LH happens 24 to 36 hours before ovulation actually happens. So a positive ovulation testing kit result does not mean that you have ovulated that same day or you are currently ovulating. It just means that ovulation is going to happen within the next 24 to 36 hours. Now, there's hope. Here are 3 simple signs that your body will give you that you can use to monitor your time leading up to ovulation. Your body will never mislead you. If you are seeing these signs, they are going to be more reliable than ovulation applications or fertility apps that a lot of us have been using. The first is the cervical mucus is like a plug that sits at the entrance into your cervix, which is the neck of the womb that will eventually lead into the uterine cavity. On my YouTube channel, which is called Hey Doc by Dr. Kady, I have an entire video where the character of your cervical mucus can help you to conceive more easily. But just very briefly, when you are about to ovulate, the character of your cervical mucus that you will see in your underwear becomes very stretchy, clear, almost like an egg white type of consistency. This type of cervical mucus makes it very easy for the sperm cells to swim through the entrance of the cervix. Then there is the mild one-sided pelvic pain that some women will experience the day of ovulation, and that is called the Mittelschmerz ovulation pain. And it happens on one side of your pelvis because very often an egg is only released from one ovary. Then the basal body temperature will also slightly increase. This happens around ovulation. So getting a basal body thermometer will be helpful in your journey to trying to get pregnant. So what if you're not ovulating? Because let's face it, some women get regular cycles, but they do not actually ovulate during those cycles. Or I should say, some women get regular periods, but do not actually ovulate within those cycles. Those are known as anovulatory cycles. These anovulatory cycles are more common in women who have hormonal conditions like PCOS or hyperactive thyroid glands or highly stressed. All of these conditions affect your hormonal balance. Another thing that will affect a woman's hormonal balance is being at the extreme end of their weight, either being underweight or being overweight. There is a way that you can work out whether or not you are one of these women who is having cycles or who is having periods but is not ovulating during those cycles, is by seeing your doctor and requesting for a day 21 progesterone levels. That is if your cycle length is 28-day cycle length. But the best way for you to work out if you are ovulating is doing a progesterone level. If your cycles are not 28-day cycles, is to then do the progesterone level 7 days before the first day of the next bleed. So the first day of your next period before that day. What the progesterone levels tell you is that after an egg is released, progesterone increases in order to sustain the pregnancy until the implanted embryo is able to form a strong placenta ground for itself within the endometrium. And so at that stage, as the embryo is trying to find its way and the progesterone levels will be high. So doing a progesterone levels on that day and the progesterone level being high on that day confirms whether or not you have ovulated. If you do the progesterone level on that day and it's low, it is likely that you have not ovulated for that cycle. But you may want to do it more than once or twice or 3 times. And if it's consistently low, then you know that you are a lady that does not ovulate. And so in the process and the journey of trying to get pregnant, you might need to adopt other methods in trying to fall pregnant. So we're coming to the soon end of this podcast. And I want to ask, now that you have this information and now that you know what you know after listening to this podcast, how will you go about optimizing falling pregnant? Remember, you can track ovulation using a combination of methods. I am not saying that there's anything wrong with using applications. I'm Just saying, do not solely rely on apps. You can use a combination of apps and some of the physical body signs and symptoms I have described. Remember, the journey in trying to fall pregnant should be holistic. That means you should maintain a healthy lifestyle, you should sleep well, and you should remain stress-free. Remember, it's not just about falling pregnant, it's about being healthy and enjoying the journey to getting pregnant. I know it will be very difficult for some of you who have been on this pathway for a very long time. But remember, if you are not healthy, getting pregnant will be harder, but also maintaining a healthy pregnancy will be challenging. Remember to seek medical help promptly. If you are under the age of 35, it is appropriate to try naturally and wait for a year before seeking the help of a specialist. If you are over the age of 35 and natural pregnancy has not happened after 6 months, then I would say you need to seek the help of a specialist. If you are 40 and older, after 3 months of trying consistently and being diligent at observing some of the other health conditions that you may already have developed at the age of 40 and older, and maintaining a good lifestyle, if it hasn't happened after 3 months, then see a specialist about being proactive in falling pregnant. Now that you understand more about ovulation, I'm hoping that this will give you better control, clarity, and it will give you greater confidence in your journey to trying to fall pregnant. Remember, ovulation is not about a specific day on the calendar. It's a biological event that requires a good understanding and good timing. If you found this episode helpful, please go ahead and share. Follow us on other social media platforms as well as other podcast platforms like Spotify and Apple Podcast. Share it with someone that you know is going through some fertility challenges and this information you think will help them. Thank you for watching. Thank you for listening, and we will see you on our next episode here on Conceived, the podcast with me, Dr. Kady.